Hello and welcome to the official YouTube channel of Lema Dental Clinic. Now firstly, let's see what is a dental implant. Before diving into the causes of dental implant failures, let's quickly review what dental implants are. A dental implant is a titanium post that's surgically placed into the jawbone to replace a missing tooth. Once the implant fuses with the bone in a process called osseointegration, it provides a stable foundation for a crown. Now, what are the common causes of dental implant failures? Let's talk about the main causes of dental implant failures. The first and most common cause is poor osseointegration, when the implant does not properly fuse with the jawbone. This can happen if the bone isn't healthy enough or if the implant is subjected to excessive stress too soon. Another cause is infection, which can occur if the bacteria enter the implant site during surgery or the healing process. Gum disease and poor oral hygiene can also contribute to implant failure, as they weaken the surrounding tissues and increase the risk of infection. Now, what are some of the risk factors for implant failure? Number 1 is smoking. Smoking can impair healing and increase the risk of infection, making it more difficult for the implant to integrate with the bone. The next one is poor bone quality. If the jawbone is too thin or too soft, the implant may not have enough support. In such cases, a bone graft may be needed. The other factor is health conditions. Conditions like diabetes, osteoporosis, or immune system disorders can affect healing and increase the risk of complications. Now, you might wonder how to avoid implant failure. Fortunately, there are steps you can take to reduce the risk of implant failure. First, make sure you're working with an experienced dentist who has a track record of successful implant placements. At Lema Dental Clinic, we use state-of-the-art technology to plan and place your implants with precision. Additionally, it's crucial to maintain excellent oral hygiene, brushing, flossing, and attending regular dental checkups. If you have any health conditions that could affect healing, discuss them with your dentist before proceeding with the implants. If you found this video helpful, please like, subscribe, and leave any questions or comments down below. Thank you for watching!